Welcome back to a deep dive where we grab your stack of source materials and really try to uncover the essential insights lurking within.
Think of us as your guides, sort of navigating that information overload, zeroing in on what's most important, and yeah, often most surprising.
Today's deep dive is squarely focused on something absolutely fundamental, I think, for anyone who steps foot in a hospital: your rights and responsibilities as a patient.
It's a topic that can feel a bit dense, maybe even intimidating, but understanding it is just so crucial for your safety and your care, really.
We've got a fascinating mix of sources here. We're pulling from the foundational principles set by major healthcare accreditation bodies.
Yeah.
Folks like Joint Commission International or JCI. They set standards globally. And India's National Accreditation Board for Hospitals and Healthcare Providers, NABH. Plus, we've got insights from a healthcare consultancy and some really practical listening discussions specifically about these rights and responsibilities.
Yeah, these sources give us the big picture from the regulatory side, the quality perspective, alongside the practical realities on the ground, what it actually feels like.
Right. So our mission in this deep dive is to move beyond just, listing these rights. We want to unpack why they matter.
Definitely.
How organizations like JCI and NABH build their quality standards around them, identify the key ones you really need to know, and most importantly, explore actionable ways you could put this knowledge into practice.
During your healthcare journey, yeah. It's about turning that information into empowerment, really.
Okay, let's unpack this. So stepping into a hospital, whether it's for yourself or, a loved one, it can feel like entering this really complex, maybe even overwhelming system.
Oh, absolutely.
And when you're feeling vulnerable, navigating that system can be the last thing you want to think about.
And that's precisely where understanding your rights becomes so powerful. The sources, well, pretty much all of them, emphasize that knowing your rights isn't just some formality, it's fundamental. It helps build trust and ensure safety in that complex place.
Right. The Lifelines blog mentioned how it ensures you receive respectful, quality care, and that you're not just sort of passively receiving things, but you're actively informed and involved in decisions about your own health.
And critically, it provides a layer of protection. Knowing your rights can help safeguard against negligence or abuse, and maybe most importantly, it empowers you to voice concerns without fear. That's something the Lifeline sources really underscore.
That empowerment part is huge, isn't it? The Lifelines podcast also pointed out that simply knowing your rights can actually help prevent medical errors.
Yeah, that's a key point.
And significantly improves communication between you and the healthcare team. It shifts the dynamic, makes it more collaborative.
And this focus on patient rights, it isn't just a hospital-by-hospital thing. It's deeply embedded in the standards set by these major accreditation bodies. Think about JCI, for instance, recognized globally for healthcare quality and patient safety. Their whole mission is to affirm the highest standards, and patient rights are just integral to achieving that. You can't really separate them.
And in India, NABH aims to establish benchmarks and create like an ecosystem for quality care. Their accreditation signals that a hospital adheres to principles that directly support patient safety and quality.
Which inherently includes respecting patient rights.
Exactly.
Yeah. JCI even has specific international patient safety goals targeting these common problem areas. And many of these goals, like ensuring correct patient identification or improving communication, they tie directly back to foundational patient rights.
Okay.
So it's clear these organizations see patient rights as a cornerstone, not just some add-on to quality care.
Okay, so let's drill down then into those core rights that seem to come up again and again across these sources. These are the non-negotiables you should probably be aware of.
Right. One of the most foundational is the right to information. The sources are very, very clear. You have the right to receive information about your health and care in a way you can actually understand.
So that means getting a clear explanation of your diagnosis.
Yep.
All the treatment options available, the potential risks and benefits of each, any alternatives you might have, and what your likely prognosis is.
Yeah.
It also includes understanding the medications you're prescribed and their potential side effects. Right?
Exactly. And the sources highlight that this right isn't just limited to the clinical stuff. You have the right to access your medical records and test reports if you ask for them.
Okay.
And crucially, it also covers getting information in a language you understand. They should provide interpreter services if needed. The Lifelines podcast specifically mentioned that hospitals and doctors have a legal and ethical obligation to provide this information.
Which leads directly, I suppose, to the right to informed consent and refusal. So armed with that information, You then have the right to make decisions about your own care.
Absolutely. No treatment or procedure should happen without your voluntary informed consent. The sources are really explicit. You have the right to refuse any recommended treatment or procedure, even if the medical team advises it.
Wow.
Or you can even withdraw consent at any time.
But they should explain the potential consequences of refusal, right? So you're still making an informed choice, even if it's against medical advice.
Precisely. And for significant procedures like major surgeries, the sources say written consent is required. It's all about your autonomy, your control over your own healthcare choices.
Another really vital right seems to be privacy and confidentiality. Your health information is, well, it's deeply personal.
It is. And the sources emphasize it must be kept secure and confidential. Your medical records should be private, and you generally have the right to control who can access that information.
So medical details are typically shared only with the healthcare team directly involved in your care.
That's the usual practice, yes. And if information needs to be shared with family or others, your consent is generally required. There are exceptions, of course, like emergencies or when the law requires it, but the principle is protecting the sensitivity of your personal health journey.
Okay. Then there's the right to quality care. This sounds fundamental, but what does it mean in practice?
The sources define this as receiving care that is safe, effective, and meets high standards.
And this is where those accreditation bodies like JCI and NABH really come in, I guess. Their standards push for this.
Exactly. Their standards directly support this right by pushing for things like timely treatment delivered with skill, maintaining a safe and hygienic environment, think infection control.
Right, that's huge.
Using evidence-based practices, ensuring staff are properly trained and qualified, and having the right medical equipment all in a clean setting. Access to pain relief and comfort measures is also explicitly mentioned as part of this right.
And perhaps the most human aspect. The right to respect and dignity.
Yes. Every patient, regardless of who they are or their condition, is entitled to be treated with courtesy and respect in a safe environment.
So this includes respecting your personal values, beliefs, your cultural and spiritual traditions. Care should be non-discriminatory.
Absolutely. And the sources clearly state you have the right to be free from any form of abuse, neglect, or physical injury, and to have privacy maintained during exams and procedures. It's about preserving your sense of self during what can be a really vulnerable time.
What if you're uncertain about a diagnosis or a treatment plan they suggest?
Good question. The sources point to the right to a second opinion.
Okay, so if you have doubts, you're entitled to seek an opinion from another qualified healthcare provider or hospital.
That's right. The Lifelines podcast highlighted this as being particularly valuable for serious or complex diagnoses. It gives you that added confidence, in the path forward.
Makes sense. And finally, there's the right to complain and seek redress. So if you're not happy with your care or you feel your rights weren't upheld, there's a formal channel.
Yes. Hospitals are required by the standards we mentioned to have a mechanism for this, often called a grievance redressal system.
Grievance redressal, okay.
You can report issues like, say, perceived medical negligence, billing errors, or maybe mistreatment. But it's not just for complaints. You can also use this channel to offer suggestions or even express satisfaction.
And the Lifelines blog even mentioned legal avenues, like the Consumer Protection Act in some places, can back this up for things like medical negligence, treating healthcare like a service.
Exactly, where expectations of quality and care apply.
Okay. Now, while these rights are absolutely essential, the sources also make it clear that healthcare is kind of a partnership.
It really is. And alongside your rights come responsibilities. Fulfilling them actually contributes to your own good care and, the overall hospital environment.
That makes perfect sense. It's a two-way street.
So one of the key responsibilities mentioned is providing complete and accurate information about yourself.
Yes, this is vital for accurate diagnosis, for effective treatment. It includes your full health history, previous conditions, hospital stays, all medications you're taking, prescriptions, over-the-counter, everything.
Okay.
Your demographic details, identity, insurance info. The treating team needs the whole picture to care for you properly.
The sources also mention abiding by hospital rules. Seems obvious, but things like the no smoking policy,
Right.
respecting visitor hours, and not bringing in outside items like food, unless maybe it's specifically permitted, flowers, or definitely no weapons.
Simple rules, really, just designed to maintain a safe, clean, healing environment for everyone. Following infection control norms is another key responsibility.
Like minimizing luggage in the ward, hand hygiene.
Exactly. And following any specific instructions the staff give you about preventing the spread of infection. It protects you and others. And treating others with respect and courtesy, that means not just the hospital staff, but also other patients, their families, visitors.
Absolutely crucial. A hospital is a shared space, often under a lot of stress, and mutual respect just makes a huge difference for everyone involved.
There's a responsibility that links directly to safety, too. Informing the treating team about everything you're taking.
Yes. Don't use any outside medications, supplements, or even alternative therapies without letting them know first. Interactions can be really dangerous.
Good point. And a practical one. The responsibility to pay for services according to the hospital's rules and regulations.
Well, yeah. Essential for the system to function. Another important responsibility, this one requires a bit of empathy maybe, is respecting the urgency of others.
What does that mean exactly?
The sources note you should be mindful that other patients might have more critical or urgent conditions. Doctors might need to attend to them first, even if you've been waiting.
Right. That could be tough in the moment, I imagine, but understandable in the bigger picture.
And finally, following the prescribed treatment plan and the instructions given by your healthcare team.
Your active participation is key, basically.
It really is, for achieving the best possible outcomes. And also accepting the measures the hospital takes to ensure the privacy and confidentiality of your records, according to their policy.
Okay, so knowing all these rights and responsibilities is one thing, but actually putting them into practice, asserting your voice when needed, that's where the real impact happens.
Totally agree. And the sources offer some really practical strategies for doing just that.
Like what?
Well, one of the most emphasized is simply asking questions. Don't ever hesitate. Seriously.
Clarify everything. If you don't understand your diagnosis, a procedure, why a medication is prescribed, or what its side effects might be, just ask.
Yeah, the Lifeline sources stress that this isn't being difficult. It's actually essential for informed decision-making and quality care. It shows you're engaged.
And if you feel your rights are being ignored, maybe you're not getting enough information, not being treated respectfully, or your privacy is breached.
The advice is to speak up. Do it respectfully, of course, but firmly.
And the sources suggest there are resources within the hospital, like asking to speak with a patient advocate or the hospital ombudsman.
Exactly. These are professionals whose job is specifically to help you navigate the system and voice your concerns. They're there to address patient issues. You can also use those hospital complaint cells or patient forums we mentioned earlier.
Okay. Understanding consent forms before you sign, that seems like a critical step too.
Oh, absolutely. The Lifeline sources were very firm on this. Always ask for a clear explanation. What's the proposed treatment? What are the benefits, the risks, the expected recovery, any alternatives? Get all that before you put your signature down.
Because your signature indicates informed consent, so you need to actually be informed.
Precisely. And keep your own records. Keep copies of your medical records, test results, prescriptions, doctor's notes, signed consent forms, reports.
Why is that so important?
It gives you a personal history, a reference point for your care journey. It helps you track things. Bringing support with you is also a smart move.
Like a family member or trusted friend?
Yeah, an advocate. Someone to support you, listen, maybe take notes and speak up for you if you're feeling too unwell or overwhelmed, to advocate effectively for yourself.
And if problems do come up, the sources advise documenting incidents. Note down dates, times, names of staff involved, what happened.
That kind of record can be invaluable if you need to follow up later.
Okay. And finally, one practical tip mentioned in the Lifelines blog, which kind of loops it back to our earlier point about standards. Taking a moment to confirm the hospital's credentials and accreditations, like NABH or JCI.
Right. While it's not a guarantee against every single issue, that accreditation signifies adherence to established quality and safety standards. It can contribute to a smoother experience overall, knowing they've met certain benchmarks.
It's also worth noting, isn't it, that family members and caregivers, they aren't just visitors. They often play a crucial role in supporting the patient and have certain rights themselves.
They do. The Lifelines podcast specifically discussed this. With the patient's consent, of course, family members generally have the right to be informed about the patient's condition.
That's key, respecting the patient's confidentiality, but allowing family to be involved.
Yes. And they also have the right to participate in discussions about care, which is particularly important if the patient maybe isn't able to communicate their wishes effectively.
And they should definitely be involved in discharge planning, right?
Oh, absolutely. Often, family members are the ones who will be providing or coordinating care once the patient leaves the hospital. So their involvement there is vital for a successful transition back home or to another facility.
And ultimately, Family members often serve as key advocates for the patient's rights, making sure their voice is heard.
They can be incredibly important allies.
So what does all this mean then? This deep dive into your source materials. It really reveals that patient rights and responsibilities aren't just abstract concepts you might see listed on a wall somewhere.
Not at all. They are concrete principles actively supported and promoted by global and national quality bodies like JCI and NABH. And there are very practical steps you can take to understand and assert them.
Understanding your rights genuinely empowers you, doesn't it? It helps you move from being just a passive patient to an active partner in your healthcare journey.
That's the goal, that partnership.
In that partnership, respecting both rights and responsibilities is ultimately what helps ensure you receive care that is safer, more respectful, and, yeah, truly transparent.
Which raises an important question for all of us, I think. If hospitals are striving for these really high standards, like JCI's vision of zero harm or NABH's aim for an ecosystem of quality, how does your active participation, asking those questions, understanding your rights, voicing concerns respectfully, how does that contribute directly to the hospital's ability to achieve their own quality and safety goals?
Interesting point. Is an informed, engaged patient actually key to a safer hospital system overall?
It's something to consider, isn't it? How our actions as patients interact with the system's goals.
Think about that dynamic as you navigate your own experiences.